Good Day Conference. I'd like to share a timeline published by the World Health Organization. On the 31st of December 2019, the Wuhan Health Commission reported a cluster of cases of pneumonia in Wuhan. On the 1st of January 2020, the World Health Organization set up the Incident Management Support Team at country level, putting the organization on an emergency footing for dealing with the outbreak. On the 4th of January, the WHO reported on social media that there were clusters of pneumonia cases in Wuhan. On the 5th of January, the WHO published disease outbreak news on the virus. This is a flagship technical publication to the world scientific and public health community. It contained a risk assessment and advice and reported on what China had told the organization about the status of patients and the public health response on the cluster of pneumonia cases in Wuhan. On the 10th of January, the WHO issued a comprehensive package of technical guidance online with advice to all countries on how to detect, test and manage potential cases. This was based on what is known about the virus at the time. This advice was shared worldwide. A lot of this advice was based on previous experience with SARS and MERS. The known modes of transmission of respiratory viruses and prevention control guidance were published to protect health workers, recommending droplet and contact precautions when caring for patients, and airborne precautions for aerosol-generating procedures conducted by health workers. I reiterate, that was the 10th of January. On the 13th of January, officials confirmed the first case of COVID-19 outside of China. I will skip over to the 30th of January. The WHO Director General reconvened the Emergency Committee. This time the committee reached consensus and advised the Director General that the outbreak constituted a public health emergency of international concern. The Director General declared the novel coronavirus a public health emergency of international concern. This is only the 6th time such an emergency has been declared. I'm not going to continue with the timeline and the response of our health officials, and I do include our dental leadership in this category, as this conference will have gone over this debacle numerous times. However, I would like to inform conference of some figures. In the 9-month period to September 2019, 321,000 tourists came straight from China to the UK. This excludes tourists not coming directly from China. In 2018, Chinese tourists made 149 million trips abroad. Did the powers that be believe that we would be exempt from this virus, so decided to sit on their hands? Dentists, their staff and families were placed directly in the firing line of this pandemic by the inaction and complacency of the powers that be. Has dentistry been so marginalized that we were not taken into any consideration during this pandemic? Were our leaders not considered important enough to be given a seat at the top table when the health of the nation was being discussed? It is testament to the rigorous protocols that clinics employed prior to this declared pandemic in December, January, February and March, during the course of general dental practice, that dentists didn't succumb en masse to this virus. It is testament to the good practice that the majority of dentists follow, that we have not been labelled as super spreaders of this virus. I remind conference this is prior to the donning of expensive PPE when the R numbers were extreme. Dentists and dentistry need a new voice and standing in the medical community, as being marginalised does not benefit us or our patients, who ultimately suffer from this iniquitous situation. I commend this motion to conference.
Okay, so there you go. That was Anthony from Bedfordshire. So do we have anyone that wants to speak to this motion? Or if so, raise your hand. Otherwise, we'll go straight to the vote. I'm not getting any, and I think people are getting the hang of the raising of the hand thing at this stage. So I'll take that as nobody. Could we go to the poll, please? This is motion 18. There we go. Okay, is everybody remembering to press their submit button? This is an England and Wales vote, remember? Okay, have we got?
There you go.
Oh, wow, look at that. That's has been carried by 94%. We had 2% against that and 4% abstained. So that motion is carried.
How many times have you heard the phrase, "Oh, you don't need to know about my new medications, it's nothing to do with my teeth"? As dentists, we know firsthand the impact that poor oral health can have on general health. The Chief Dental Officer has called for the mouth to be put back into the body, and the BDA launched a campaign last year citing dentistry as the missing piece. Some patients will have more interactions with us than they will do their doctor, and we may be the first to identify habits which could cause health problems in later life. For example, a high caries rate suggests a high sugar diet, which could then lead to obesity, heart disease and diabetes. If we could log this information within a patient's medical record, then it could lead to signposting to other healthcare services. With this in mind, why is dentistry still not included in the NHS digital framework? Throughout the lockdown, I think many of us discovered the difficulty of triaging dental pain over the phone and then ringing around pharmacies hoping someone would accept a remote prescription. The CDO asked us to implement virtual consultations and remote prescribing. How does a practice do this though, without some sort of technology at its disposal? Yes, the NHS is complex with many organisations that don't always work together, but with a bit of joined up thinking across all healthcare services, we can provide better care and better outcomes for our patients. I thought maybe the technology just wasn't there, but it is. NHS Digital Services is actually really well developed and there are many long-term plans, but none of them mention dentistry. Unfortunately, there's the issue of funding and who pays for it. If we are asking for contract reform, we should also be asking for a digital framework that can link oral health to general health. Access to a patient's summary care record would help the dentist formulate a treatment plan appropriate to the patient's medical needs. Maybe dental information could then be integrated into the NHS digital app and targeted dental messages sent directly to the patient's phone. The technology is there, and yes, it will require initial funding from the NHS, but ultimately costs would reduce for the future. This is all about integration and collaboration of all healthcare services. Access to summary care records is just the start. So let's put the mouth back into the body and show that dentistry deserves a section within the NHS digital framework. Please support this motion.
Thank you, Zoe. Now then, does anybody wish to speak? We've got somebody showing up as Coastal. I presume that's Lancashire and South Cumbria. There's no name here, so Mr. or Mrs. Coastal, would you care to speak?
Stuart Johnson for Lancashire Coastal. I'd like to speak for the motion. This was something that was promised by NHS Digital, as it was many years ago at conference, and could only benefit patient care. But actually, just as NHS.net improves private practices looking after patients, it should be available to all dentists across dentistry, regardless of NHS or the care basis.
Thank you. We've got a hand up from Philip Martin from Leicestershire. Would you care to speak?
Yeah, thanks. I was just going to say that certainly in the East Midlands, Jason Wong's worked very hard to get the summary care record included in all minor oral surgery records now. And as a minor oral surgery practice, I think that's been a brilliant initiative and I think it should be rolled out to all dentistry. So please support the motion.
Thank you. Does anybody else wish to speak? No. In that case, we will move.
Sorry, Stuart.
Sorry.
I think
Oh,
Roger Levy's got his name in the.
oh yes, yeah, yes, it has, and Dave Cotton's just sprung up on my machine. A little bit too quick. Roger, would you care to address us?
Yes, thanks. I think this is good, and of course it goes also towards the motion that was earlier passed almost unanimously, which was to the effect that NHS dentistry needed to be considered part of NHS primary care services across the board. So it's part of that. One thing though that we need to bear in mind is that if dentistry has access to summary care records, then it's going to be a relatively short step from us being expected to upload dental records into summary care data as well. So we need to be aware of that. Obviously, there are also cost issues and other things. It's a good idea, but it's a little bit more complex perhaps than it appears at first.
Thank you, Roger. Dave Cotton, I understand you wish to speak. Are you for or against, sir?
It's just on the clarification issue, please, Stuart, on who's entitled to vote. There's a lot of chat going on there, and we need some clarification, please.
Okay, well, one of the simplest ways to do this, if you look on the agenda for today, you'll see that we have written out in a box at the bottom exactly who's voting at which time. This particular one is UK policy, so it's UK wide. It's LDC Agenda Committee, not GDPC. Right. Now, does anybody else wish to speak? No. In that case, we'll move to the vote. We're back on this new method of doing it. So into participants, and yes or no at the bottom, and more if you wish to abstain.
Eddie's hand just went up and then down. I'm not sure if Eddie wants to chip in, but we're too late for that.
Afraid it is. That's interesting. I don't know if there's a delay on mine, but I didn't see anything with
Sorry,
that.
you just pressed the wrong button. It's next to the yes button, so ignore me.
I think you were just waving, weren't you, Eddie?
I wouldn't dare ignore you ever, Eddie.
So, Stuart, votes are coming through.
Okay.
That's fine. People have found the buttons.
One of the questions raised in the chat has been this renders the vote not secret, but then the vote never was secret on purpose. If you remember, the traditional way of voting at conference was holding cards up, putting your mitt in the air, which was public. So it's never been a policy decision that these votes are secret.
I can announce that motion was carried.
Okay, and we'll be getting percentages later.
I'm working on a spreadsheet for you right now.
I'm delighted to hear it. Thank you.
The Kent LDC motion is, this conference believes that primary care dentists should have access to electronic prescribing. In wording this motion, we have deliberately kept the wording straightforward to ask conference to support the principle of electronic prescribing of medicines by primary care dentists. As a conference, we vote on motions for the GDPC to take forwards on our behalf. Electronic prescribing should simply be included as one element of the whole digital transformation of dentistry agenda. Where it sits in the list of priorities is clearly for further debate, and doubtless the prioritisation and delivery will depend on the budget and resources available. We are simply asking for electronic prescribing to be on that list of digital priorities for primary care dentists. If we had electronic prescribing, the prescription you initiate could arrive at a pharmacy in the same way that a GP's prescription arrives. We could also remove one of the last remaining pieces of paper from the modern dental practice. Whilst we all endorse the view that if clinical treatment is appropriate to be undertaken, then that should be preferred to prescribing, there will still always be the occasions when clinical treatment cannot be undertaken, and as dentists we need to prescribe medication. During the lockdown, the virtues of having access to electronic prescribing were made only too clear to all of us involved in trying to help patients. Dental prescribing via the emergency supply of medicines arrangements was fraught with difficulties for dentists, pharmacists, and as a result often caused problems for patients. So please vote for this motion to endorse the principle of electronic prescribing of medicines by primary care dentists. Thank you, conference.
Thank you, Hugh. Now, I have no hands up at the moment, but I'm waiting patiently as these things don't seem to appear straight away. No, nobody wishes to speak. Okay, can we move to the vote then, please?
We had a hand come up just as the vote was coming forward. Kent LDC.
Who was that, Russell?
Nazir's hand came up just as the vote was going forward.
Stuart.
Well, oh yeah. Well, do you want me to pause the vote then, and we can hear from Nazir?
We haven't announced it, and we have done that before, but everybody will have to vote again, so I can clear it and carry on.
Please do. I think that's the most appropriate thing to do.
Thank you.
Nazir, the floor is yours.
Sorry, I wanted to just very quickly say that I was just fully in agreement with this. I apologise for having members to re-vote. This has been a bane on many practices, I know, and getting patients into and out of the surgery, with pharmacists often not being able to prescribe with other electrical ways of doing so. Please support this motion. I think it's time that we were all integrated into the NHS electronic prescription network.
Thank you. Right, carefully looking for any other hands. So now, could I ask you to vote again? And apologies for having to ask for that twice.
Darren has also put the motion back up on the screen.
Indeed, yes, yes. In response to a request in the chat, would encourage people to use the chat to get messages like that across. This is very much a learning experience this year, as you probably appreciate.
Okay, I think we have not quite unanimous, I'm afraid, but that motion is a 4 vote.
Thank you, Benel. Okay, that's very good. So